Okay, you can start recording. We'll just adjust it. Have you ever decided on a restaurant based on the influence of other customers? Based on reviews from Yelp, TripAdvisor, Google, Foursquare, Facebook, or Twitter? What about your selection process for healthcare? This discussion is an overview of the hospital consumer assessment of healthcare providers and systems, also known as HCAHPS. Our discussion today is an overview of the HCAHPS process, development, testing, and endorsement, HCAHPS content and administration, public reporting, measures, adjustments, and our resources. HCAHPS serves as the first nationally standardized method for collecting and publicly reporting patient experiences, which allows for consumer comparisons. Because Medicare requires that hospitals collect and report data in order to receive their annual payment update, HCAHPS has quickly become the national standard for assessing patient experiences with hospital care. The HCAHPS survey is administered to samples of medical, surgical, and obstetric patients, and it measures 9 key aspects of care quality, which will be discussed later. HCAHPS places particular value on the consistency of care by using a frequency scale to measure consistent patients' experiences. Our next section, development, testing, and endorsement, will be presented by Nazreen.
In 2002, Centers for Medicare and Medicaid Services partnered with the Agency for Healthcare Research and Quality, AHRQ, which is another federal agency, to develop and test the HCAHPS survey. AHRQ carried out a rigorous and scientific process, including a public calls for measure, literature review, cognitive interviews, consumer focus groups, stakeholder input, a 3-state pilot test, extensive psychometric analysis, consumer testing, and numerous small-scale field tests to come up with the survey. CMS provided 3 separate opportunities for the public to comment on the HCAHPS and responded to almost 1,000 comments. In May of 2005, the HCAHPS survey was endorsed by the National Quality Forum, which is a national organization that represents many healthcare providers, consumer groups, professional associations, federal agencies, and research organizations. In 2005, December, the Federal Office of Management and Budget gave its final approval for the national implementation of HCAHPS for public reporting purposes. CMS implemented HCAHPS in October of 2006, and the first public reporting results occurred in March of 2008. The survey and the results it produces are in the public domain. Hospitals implement HCAHPS under the Hospital Quality Alliance, which has endorsed HCAHPS. The Hospital Quality Alliance is a private-public partnership that includes major hospitals, consumer groups, accrediting bodies, government agencies, and other groups that share an interest in improving the hospital quality. The enactment of the Deficit Reduction Act of 2005 has created additional incentives for acute care hospitals to participate in HCAHPS. Since 2007, hospitals that receive annual payment provision from the Inpatient Prospective Payment System, also called IPPS, must collect and submit HCAHPS data to receive payment, and if they don't, they are subject to a 2% penalty. Non-IPPS hospitals such as critical access hospitals, may voluntarily participate in HCAHPS. The Affordable Care Act of 2010 also includes a provision for HCAHPS among the measures to be used to calculate value-based incentive, beginning with discharges in October of 2012. In the first expansion of the survey since implementation, CMS has added 5 new items to the survey in January 2013. 3 questions were about transitioning to post-hospital care, 1 question about admission through ER, and 1 question about mental and emotional health. To talk further about the actual survey, we have Judy here.
Keep in mind, the survey refers to the patient's perspective. The HCAHPS survey asks discharged patients 27 questions about their recent hospital stay. The survey contains 18 core questions about critical aspects of patients' hospital experience. The 9 key aspects of care quality are communication with doctors, nurses, responsiveness of hospital environment, quietness of the hospital environment, pain management, communication about medicines, discharge information, overall rating of hospital, and recommendation of hospital. Included are 3 items to adjust for the mix of patients across hospitals and 2 items that support congressionally mandated. Included are the 3 questions, which consist of the education level, language spoken at home, and the age. The HCAHPS survey is administered to a random sample of adult patients across medical conditions between 48 hours and 6 weeks after discharge. HCAHPS can be implemented in 4 different survey modes: mail, telephone, mail with telephone follow-up, or active interactive voice recognition, known as IVR. On average, it takes respondents about 7 minutes to complete the HCAHPS survey. The core set of HCAHPS questions can be combined with customized hospital-specific items to complement the data hospitals collect to support internal customer service and quality-related activities. The survey itself is available in English, Spanish, Chinese, Russian, and Vietnamese in the mail format. The telephone and interactive voice recognition are only available in English and Spanish. The actual wording of the HCAHPS questions and response categories, as well as the scripts for conducting the survey in the telephone and active interactive voice response modes, can be found under the survey instruments on the HCAHPS website. Hospitals must survey patients throughout each month of the year. Ayla will now review the reporting process.
First public reporting of HCAHPS began in March 2008 when 2,421 hospitals reported scores based on 1.1 million surveys done, and it's been growing since then. In July 2013, 3,928 hospitals reported their HCAHPS scores based on 3.1 million surveys done. These surveys are done 4 times a year, and the HCAHPS scores are based on the 4 most recent surveys. So every time a new survey is reported, the last one is rolled off as an archive. These surveys are reported on Medicare Hospital Compare website. The link is up there. Hospital Compare has HCAHPS information and scores for 4,000 Medicare certified hospitals across the country. This is an interactive web page in which you can also choose to compare the 3 hospitals and also narrow down your search through different criteria. In addition to the Hospital Compare website, summaries, analysis, and national comparisons of all current and historical HCAHPS scores can be found on HCAHPS' online website. You may compare. The measures. HCAHPS results are reported publicly on Hospital Compare in form of 11 measures, and these measures are made out of the questions asked on the survey. These 11 measures are also reported along with the state and national averages for comparison. These 11 measures consist of the composite topics, nurse communication, doctor communication, responsiveness of hospital staff, pain management, communication about medicines, discharge information, care transition, the individual items, cleanliness of hospital environment, quietness of hospital environment, and the global items, which include overall rating of the hospital and willingness to recommend the hospital. Also, there is a new initiative to add 5-star quality ratings to all these measures in April 2015 to make it more easier for consumers to compare the information. The adjustments. HCAHPS surveys are not reported in raw form, but actually some adjustments are done before publishing them. These are the mode and patient mix adjustments. A research was done that it was determined that HCAHPS results vary among hospitals based on certain factors, which are beyond the hospital control. It varied based on the mode of the survey done, like either it's done by mail, telephone, mail combined with telephone, or through IVR. Also, other factors affecting were the mix of patient based on age, education, and their self-rated health status. So to avoid bias, a calculation system was adopted to make post-survey adjustment, and then the scores were reported. Derek will now give the closing argument.
In conclusion, the notable associations between measures of patient experiences of care and technical quality and safety in hospitals suggest that HCAHPS measures are important new measures for hospital care quality. Even though further study is necessary to further identify the implications of these relationships for improving hospital care. So what we've presented today is a general overview of HCAHPS. Next, we talked about the development, the testing, and endorsement phases. Following that, we had the HCAHPS content and administration. And lastly, public reporting, measures, and adjustments. As another reference, the questions are also listed on pages 173 and 174 of the text. Our additional resources and references we've cited include the HCAHPS landing page on the CMS website, the CAHPS survey page, which is the second link provided, and then lastly, a journal that's been cited as well throughout the presentation, the relationship between patients' perception of care and measures of hospital quality and safety. This concludes the presentation on HCAHPS. Again, this is measuring quality and performance.